Hi, welcome back to the channel. Thank you for joining me. Thank you for your continued support. I really do appreciate it. So we've heard a lot about the Labour government wanting to improve social care, and they said that they have this plan in place which they're going to go for in terms of trying to find the way to improve social care. And part of the reason they want to do that is because they want to take more pressure off of the NHS. So Wes Streeting made an announcement, but it's not the announcement a lot of people were expecting. He said that the social care situation, in terms of the looking into it, the research, the the proposals and things like that they're going to look for, won't actually be completed until 2028. So that is a long way off. That is a long way off. Apparently in 2026 there's going to be a document that's going to be prepared for Keir Starmer, and in that it will talk about what the short to medium term aims should be for social care, and then in 2028 there will be another report detailing what the mid to long term strategy should be. So it looks as though it's going to be a long time before we see any meaningful change to the social care system, which is really not a good thing at all when you consider the amount of flu that's around at the moment and how stretched the NHS are already. It's a bit disappointing that he hasn't come out with something that could be put in place at least for next winter, but it looks as though it's going to be at least a couple of years before they get any short-term measures in place, which is going to be a big problem. And I think it means that the NHS is going to be suffering for a while longer before anything meaningful happens. So it's disappointing, obviously, because especially if as I've said this before, especially if they want to get people into work and they want to deal with social care so that they can free up appointments to hospitals, so that people who may be wanting to go back to work and get appointments and get treatment and stuff like that. It's all a building block process. If you deal with social care, you free up appointments, you free up operation slots, you manage the situation a lot better. If we're not going to see anything happen until 2026 at the earliest, then that puts his whole strategy of getting Britain working again into a bit of an uncertainty, because I think that he's going to be unable, I don't think, to get many people back into work who are currently sick or disabled, because there just isn't the support there isn't the foundations there with which he can work through. So it looks like it's a bit of a damp squib in terms of the social care situation. Now, of course, they've got other things coming in as well, but this is going to be the main thing that's going to help support people and have a knock-on effect for the NHS. So I think if this isn't going to go through till 2026, I think he's going to be struggling to get people into work as the way he's talking about it. But let me know down in the comment section what you think about this. What do you think the impact's going to be on this not starting till at least 2026, if not 2028? Let me know what you think about that. Let me know down in the comment section what you think, as always, and I will see you next.